Hi, everyone. Welcome to today's webinar. My name is Kiersey. I'm at the California Pan-Ethnic Health Network, and I'll be your facilitator today. It looks like we're right at 11, so we can get started. Today's webinar is part of our four-part webinar series that explores the topic of oral health in California. So the goal of our webinar series overall is to spread foundational knowledge on what oral health is, how it's delivered, in order to inform how we can serve our communities. We've heard from CPAN partners that knowing how to navigate the oral health system is a priority for their communities. So we hope this information can be shared amongst you and your colleagues and used to benefit your work. As I mentioned, we're doing a four-part series. Today's webinar will be focusing on sort of the procedures and codes and services that are covered given what status of insurance you have. We do have tentative upcoming webinars. We'll have one on the workforce, the oral health workforce, coming up in August, most likely. We will also have one on oral health in our communities where we can highlight some of our community best practices and successes. We will always have these webinars on Thursdays at 11 a.m., but the dates at the moment are tentative while we confirm speakers. So please go ahead and register online as you registered for this webinar, and we will be sure to share that information on the date as soon as we can. Just a few quick housekeeping items before we dive in. We hope that this can be a real learning environment for folks, despite it being a webinar context. Our presenters are really great and are a resource to you today and going forward. So we hope that you ask your questions today as they're presenting. You can use the question feature on your screen to ask a question at any point. We will be monitoring them, and we will wait till the very end and leave enough time to have a discussion with those questions. We will start by having our two presenters speak from their slides for the majority of the session, and then we will have 15 minutes to do Q&A at the end. So again, ask your questions. You should all have joined the webinar in listen-only mode, so you should be muted. Again, use your question and chat feature to communicate with us. And just an FYI, the webinar will be recorded, and we'll share slides, handouts, and a recording shortly after the webinar. So with that, I'd like to jump into our content. So I'll introduce our speakers, and then I will turn it over to them. So we have two amazing speakers today. They're great oral health advocates, have been in the field for many years, and we're really grateful to have them with us today. So we will begin with Liz Ramirez. Liz is the Director of Training and Education for Maternal and Child Health Access. We're thrilled to have her. She is an experienced trainer and educator for agencies, advocates, and community members on access to healthcare and benefits eligibility. As part of her work, she provides a core course for agencies, school, clinics, and social service staff called We've Got You Covered, which explains dozens of health programs and services available in LA County. Today, Liz is going to focus on the landscape of covered services under Denti-Cal and kind of discuss what's available to folks on Medi-Cal, whether full scope or limited, on Covered California or otherwise. Then we'll turn it over to Dr. Irene Helton, a dental consultant with the National Network for Oral Health Access, the national organization of oral health providers working in federally funded health centers and other safety net programs. She's also a clinical staff dentist at the San Francisco Department of Public Health. Dr. Hilton is an excellent advocate and dentist who works to improve oral health integration and safety net dental care. Today, Dr. Hilton will discuss what's helpful for advocates to know when referring to specific oral health services, discussing services from preventive services like sealants and varnishes to restorative services like crowns and more. So we thank you both for joining us today. We thank you all audience members for joining us. We're excited to engage in the discussion with you. So please remember to type your questions for the presenters in the question box, and you can do so throughout today's webinar, and we will be monitoring them. So with that, I'd like to turn it over to Liz, who will kick it off.
Thank you so much. Really happy to be here with you all today. So I'm going to be covering dental coverage. We're going to talk Medi-Cal, Covered California, and what do we do for folks who are not eligible for comprehensive dental services. Slide. So again, I work for Maternal and Child Health Access. And our mission is to improve the health of low-income women and their families through advocacy, education, training, and services. And although our name is Maternal and Child Health Access, we work with everyone, so not just women and children. Next slide. So we're going to just dive right in because, as always, I put too much in. So I wanted to make sure to hit some high points with you all. To try to kind of explain this craziness that we have here of dental coverage based on who you are. So talking about Medi-Cal, what is Medi-Cal? It's insurance, and it's actually really good insurance. It's California's Medicaid program. So Medicaid is a federal program, so the federal government sets the rules. They tell the states, in order to participate, you need to include, for example, outpatient care, inpatient care, durable medical equipment, prescriptions, just to name a few. So they set the rules of what you need to cover in order to participate in the Medicaid program. But states have the option of using state dollars to include more services. Adult dental being one of them, as well as vision, glasses for adults. Those are paid with state funding. Slide. So back in the 80s, adult beneficiaries had access to exams, x-rays, teeth cleaning, emergency treatment, tooth extraction, root canals, again, being paid with state dollars. But back in 2007, 2008, our economy got tanked. And, when the economy's bad, what happens? Budget cuts. So they looked at the state add-ons, the dental, the vision, and other services that Medi-Cal was providing, and they cut them. Now the federal government says you have to provide comprehensive dental coverage for kids under 21. So that's a federal rule, and that stayed in place. As our economy got a little better, we were able to, in 2014, to add back some of the benefits that were taken away. So they gave root canals on the front teeth, full dentures. So it was very limited. It wasn't the full package of what they were getting back prior to 2009. And during that time of the partial restoration, pregnant women who had Medi-Cal coverage received full benefits. So they're to be treated as if they have full coverage. And here we are in January with the full restoration of adult dental services. So just to kind of set context for why dental benefits were taken away and how we incrementally got them back. Okay, next slide. Like I said, the federal government, they set the rules. So a federal requirement is something that we call FRADS, Federally Required Adult Dental Services. So this continued even when they eliminated the adult dental in 2009. So these are not procedures like root canals, fillings, or dentures. These procedures were benefits that treat or alleviate major trauma, like a gunshot wound to your mouth or jaw. Or a deep teeth cleaning is needed before you have heart surgery. It's a prerequisite. So that is still a federal mandate that had to be covered, and it is still covered today. Next slide. So the dental portion of Medi-Cal is called Denti-Cal. Next slide. You have this as a handout, but I put it on the screen so we can talk about it, because we have full scope, restricted scope, pregnancy related, and residing in a skilled nursing facility. What does that mean? Who gets what? Immigration status determines the level of benefits that one receives. So folks who have satisfactory immigration status, so citizens, legal permanent residents, which are green card holders, or folks who immigration knows that they're here in the US and that there's no order of deportation, are able to get full scope under a program called PRUCAL, permanently residing under the color of law. So those are the folks that get full scope services. But in Medi-Cal, there's always some exceptions. So because of Senate Bill 75, Health for All Kids, kids under 19 were given full scope benefits regardless of their immigration status. So that's who gets the full scope coverage, and you can go down the road to look at the different services and procedures that one can get with full scope Medi-Cal. Now, restricted scope. Notice I didn't say emergency. A lot of folks use that term, and we like to use the term restricted because it does cover more than just emergencies. So what will restricted Medi-Cal cover? It's going to cover what a reasonable person would believe that without immediate medical intervention, they could potentially lose their life or limb. But let me tell you that sometimes it's the savviness of the biller that gets things covered. The justification that this was really a threat to life or limb. And folks on restricted Medi-Cal also get the FRADs, those federally required adult dental benefits. Now, pregnant women. Let's look at pregnant women. They get almost all the same procedures as full scope, with two that they don't qualify for because they're not under 3 and they're not in a skilled nursing facility. So a pregnant woman with Medi-Cal coverage is to be treated as if she has full scope benefits. And I'll talk a little bit more about that in a second. Next slide, please. Okay, so let's talk coverage for kids first. So as I said, kids under 19 who have Medi-Cal coverage are eligible for full scope services. So all the benefits that Medi-Cal covers. And this includes our SB 75 kids who would, before SB 75, were eligible for the restricted scope. So under 19, they have full scope coverage and they're eligible for something called EPSDT. And I'll talk about that in a second. Now, if the child continues to be eligible for Medi-Cal, for benefits, they're still considered a child until they're 21. So they still get the full coverage and they continue to be eligible for EPSDT. So EPSDT is a federal requirement. It's to provide early and periodic screening, diagnosis, and treatment. What does that mean? It basically means it's a more liberal definition of what is medically necessary. So I'm going to give you 2 examples. You know, just like our insurance, when we are trying to get something covered that is not normally covered, we have to go through a process. In Medi-Cal, that process is called a treatment authorization request, or a TAR. So there was a child who had severe asthma. Medi-Cal paid for 2 nebulizers that plug in, so he could have one at home and have one at school. But this child's classroom went out on a lot of field trips, and this young man was not able to attend. So they went back to Medi-Cal and they asked, can you please cover a portable nebulizer? They submitted the treatment authorization request and it was denied. You already have 2. It reached an advocate, our fellow partner with Neighborhood Legal Services Health Consumer Center, who then said, let's resubmit this TAR under the EPSDT standard, again, a more liberal definition of what is medically necessary. And the justification was that this child's education was being impeded because he could not go out on field trips. Medi-Cal paid for the portable nebulizer. We also see this sometimes with dental. So Medi-Cal will cover braces if it's medically necessary. So they have a grading system, a point system that you must meet, and if you don't meet it, you're not eligible. So there was a client who didn't meet the listing, but she was suffering trauma. She was going to school and being teased and bullied, called Bugs Bunny, giving her severe anxiety. It was noted with the school counselor and her own therapist. And again, submitting a treatment authorization request under this EPSDT standard, showing that it was harming her psychosocial development as well as impeding her education because she didn't want to go to school because she was being teased. It was able to cover the braces. So EPSDT is really important. It is available to kids up until the age of 21, provided that they have full scope benefits. So I provided a link if you are interested in reading a little more about EPSDT below on this slide. Next slide, please. Okay. But what happens when a beneficiary turns 19? So Medi-Cal is like a house, and they have these different rooms in this house that target different populations. So on your screen, you see a little chart, and it says 266% federal poverty level. So this is the program, the income ceiling that we screen for kids that are under 19. So if you looked at a family of 4, the income ceiling to be able to get Medi-Cal is $5,564 gross per month. Before their 19th birthday, they are screened for a different Medi-Cal room because they're going to age out of the 266 program. So then they're evaluated for the 138. And if you look at that same family size of 4, you can see that the income drops dramatically. So now the income ceiling is $2,887. So you potentially can see kids losing their Medi-Cal when they turn 19 because the amount of income they're allowed to earn drops. Losing coverage would then open up special enrollment into Covered California, and most likely that would be the program that they would then enroll into. Now, the same thing happens for our SB 75 beneficiaries who have been benefiting from this full scope coverage under the Health for All Kids. But so they get the income screening to see if they still fit, but they also look at their immigration status and check to see has anything changed, or are they still considered undocumented. If nothing's changed and they're still considered undocumented, then their benefits are going to be reduced back to the limited scope Medi-Cal. And again, they continue to be eligible for the FRADs. Next slide, please. Adult coverage. So thankfully, we have fully restored dental for adults. So those with satisfactory immigration status are going to get the full scope benefits. Adults over 21 who have limited scope are, and again, going to have that emergency, if without immediate medical intervention, there could be threat to life or limb. They're going to be able to access dental benefits that meet that criteria, along with the FRADs. And then what we do for folks is then layer different local resources to meet the needs, which can be sometimes difficult to find resources. Next slide, please. So coverage for pregnant women. So this chart kind of confused myself, I thought, and so I'm just going to throw it out there that any pregnant woman with Medi-Cal coverage is to be treated as if she's got full scope Medi-Cal. So that's regardless of immigration status. So you will have women who are undocumented who have this pregnancy Medi-Cal, and they're to be treated as if they have full scope coverage, eligible for all the services that Medi-Cal provides. CMS, the Center for Medicare and Medi-Cal Services, declared pregnancy Medi-Cal MEC, minimal essential coverage. That's standard that meets the mandate to have coverage. So women with this limited scope, something to flag is that it's full scope coverage during their pregnancy and their postpartum. Their postpartum is the birth month plus 2 more months. And after that, their benefits are going to revert back to just the restricted scope services. So it's really important, because time is of the essence, to get the appointments that they need, to get them into the specialty docs, to get them there to the dentist to do the more invasive dental treatment. But sometimes getting a timely appointment can be an issue. And like I said, the clock is ticking, because we have this full scope coverage for the birth month plus 2 more. So we work really hard to try to make appointments happen. Again, any woman with pregnancy Medi-Cal is to be treated as if she has full scope coverage. Next slide. So this is the BIC card, the benefit identification card. We have the old school one, the blue and white, and we just a few years ago had Medi-Cal's 50th anniversary. So they created a new card with the California poppies on it. It's the same card. They just are reissuing it to new beneficiaries or to folks who lost their card and get reissued a new one. It's really important that we do education on the front end, because folks get this card in the mail and they look at it, and do you see a tooth on this card? How would you know that you had dental? How would you know that for the majority of people in California, this is the card that you're going to use to access your dental? Dental has been carved out for the most part of the physical health, along with mental health and substance abuse. So having clients understand when you use this card versus when you use your health plan card is very important. Next slide. So in Los Angeles and Sacramento, they is a pilot where they're trying to do a combination of folks in both fee-for-service, meaning I can go to any provider that accepts Denti-Cal, I'm not locked into a managed care, or I can assign my dental to a managed care plan. In LA County, we have these 3 options: Access Dental, Health Net of California, and Liberty Dental. And in Sacramento, they have geographic managed care, and I do believe that they still have the ability to option fee-for-service. Next slide. So I invite you to take a look at the Denti-Cal website. It's a lot of work that we do is reading the provider bulletins and handbooks and procedures of how things should work. So it's a good resource. I invite you to check it out. Next slide. So our friends at Insure Kids Now also have a search engine to locate a dentist. We want to make sure that we encourage the utilization of dental benefits for our kids, because not a lot of them are taking up the dental services that they're eligible for. So we want to make sure that we encourage kids to get their dental checkups. Next slide. So helping your clients. You know, we do get calls. I got a call 3 weeks ago from someone who said, I was charged X amount of dollars for a porcelain crown, and my dentist told me that Medi-Cal didn't cover a porcelain crown. Now, dental is a whole other language. So what I did was email dental@dhcs.ca.gov And I asked this question, do you cover porcelain crowns? And they responded, yes, but it has to be pre-authorized, that pre-authorization, that TAR. I explained that I had a client that was billed for it, and they asked me to have the client contact DHCS so that they could work with the provider on getting the correct billing code so that it could be covered via Medi-Cal and the client could get paid back their $500. So when in doubt, you have DHCS as a resource to call. They can answer questions. You can check to see, has there been a treatment authorization request submitted? Because sometimes I feel like we're detectives. So I have a client who says, they say that Denti-Cal doesn't cover this. And so we ask, did they try to get it covered? Did they bill for it? Did they submit a TAR? If they did submit a TAR, what was the denial reason? Because clients, Medi-Cal recipients have due process and they have the right to appeal that decision. Sometimes we find out that a TAR was never submitted. Maybe in the past, the dental provider got that kind of bill kicked out, and so they're under the impression that Medi-Cal doesn't cover that. So we just need to ask questions. And you can definitely forward cases over to us, to Maternal and Child Health Access, high-risk cases, especially with pregnant women, which is our specialty. Next slide. So I'm going to leave the world of Medi-Cal, and we're going to talk a little bit about Covered California. So Covered California is our health exchange, and this was designed to pick up income-wise where Medi-Cal leaves off. So if your income was too high for Medi-Cal, the next program we would look for coverage would be Covered California, the health exchange. Next slide, please. So it's our marketplace where, based on your income, you could get help paying your monthly premium in the form of an advanced premium tax credit. If you income qualify, you can also get help getting smaller co-payments. And Covered California is the only place that you can receive this kind of assistance. Next slide, please. So dental plans were added in and embedded for kids. Again, federal government, you need to, for kids under 19, it's mandatory to include dental as part of their package. So it's included, it's embedded in the managed care plan that they pick. Adults also have the option to purchase dental, but it's not part of the package, meaning for the kids, if they're eligible for a tax subsidy, their dental is going to be included in that. They're going to apply some of the subsidy to the dental. But if you're an adult, you purchase it through Covered California, but you're going to pay full price. You're not going to get tax subsidies, even if you were eligible for the dental portion. Next slide. So, like I said, they're embedded. Health plan is embedded pediatric dental. So if I chose LA Care, my dental is going to be Liberty Dental. If I choose Molina, I'm going to get California Dental Network, and so forth. So the health plan is going to determine which dental plan you're going to get. Next slide. So I invite you to play around on the Covered California website. You log on, click on Get Covered. There's a link that says Shop and Compare. Click on that. Next slide, please. And you can put in some information. So for this person, coverage year 2018, my zip code is 90065, $3,500,000 per year of income, and you can put yearly, monthly, and how many people are in your house and what is your age. So based on that information, it's going to show me what I'm eligible for. So in this scenario, you see if I were to choose Molina, my monthly premium is going to cost me $167.59 after the tax credit that I'm eligible for. The one I'm eligible for $169.73. So I do get a little bit of help. So you can take a look at that. But I want you to look at the dental plan. So there's a toggle up at the top that says dental. You want to click on that. Next slide, please. And then it shows you your dental options. So on this one, monthly premium would be $772. This is for an adult. And if you click on View Detail, it will open up another screen where you can then access the summary of benefits and coverage. So it will have the evidence of coverage in there, so you can kind of dig down and see what exactly it's going to cover and cost. Next slide. And this is just the front snapshot of the big packet of information. So it explains out-of-pocket maximums, what's the deductible, is there a waiting period for any of the services? So you can actually dig in and see what this plan is going to cover and how much it's going to cost. Is there a waiting period for certain services? So I invite you to take a look at that and play around in that Shop and Compare tool on Covered California. Next slide. Okay, what about the rest of us, right? What about the folks that either only have restricted Medi-Cal or folks that are just uninsured? They didn't enroll into coverage when they were supposed to. Now Covered California is closed for enrollment, but now they have a need. What are we going to do? Next slide. So we have our federally qualified health centers, our FQHCs, that provide medical, primary care, preventive dental services, and some of those clinics have dental clinics, and they can provide more extensive treatment. We sometimes call them community clinics, and they can also provide dental for those without coverage. I included a few different links of finding clinics, FQHCs, in your area. And this is when we need to start to think out of the box. Teaching dental schools. USC does a lot of dental work. How can we patch together different local referrals to meet the needs of our client? And that sometimes is a very daunting task. Next slide. So I gave you a lot of information. Please don't hesitate to contact me and ask questions. I'd be happy to answer, and I will answer questions at the end of Dr. Hilton's presentation. Thank you.
Thank you, Liz. That was great. Thank you all for starting to type in your questions. Please keep them coming, and we will get to them at the end of the presentations today. So with that, I'd like to turn it over to Dr. Hilton to get a little bit more into the actual procedure.
Good morning, everyone. So I was asked to follow up Liz's excellent presentation with just like almost like a translation, because dental is like its own language, and what does the procedures and the things that is actually like in the handbook, or the dentist will say this and this and this is covered and not covered. What does it mean, like in like real language? So hopefully this will help you to be able to understand what your clients might be telling you, or talk to your clients. I mean, not expecting that you'll memorize all this, but maybe just have this like a little cheat sheet, of the presentation so that you can refer to it. Okay, next slide. Okay, so basically what I did was the list that was in Liz's presentation about what, some of the general categories and procedures that are covered. I just put it on the top, and then this is kind of like what it really means, and kind of like explaining what it is. So one of the benefits that you get under Denti-Cal, of course, is exams or evaluations. These are just two different words for the same thing, which basically most people know it as like the checkup. The checkup when you go and you find out what it is that you need. So usually for most people, if it's not an emergency, but like what you would call a regular checkup, you go to the office, usually you get a bunch of x-rays, and dentist figures out what it is that you need. And then, there's that discussion about what is or isn't covered by your insurance. It's the same whether you're on Medi-Cal insurance, commercial insurance, or paying on your own. The only difference is that in Denti-Cal, the number of like exams or evaluations that you get like in a given year it varies by age. There's just different numbers that you can get, if you're a really small kid versus a adolescent versus an adult. So that's about the main thing to say about exams and evaluations. Next slide. So before we can talk about like the rest of the procedures, I just wanted to talk a little bit about what are we really trying to treat or do with those procedures. The most common dental diseases that most dental expenditures are for is either to treat and address dental caries or periodontal disease. I mean, yes, there's some funding that goes, for example, if you have oral cancer, or if you need braces, which is like would be crowding, which could be another type of condition. But mainly, there's like two main what we call dental diseases: dental caries and periodontal disease. But usually they have other names. So dental caries, that's actually, it's really cavities. It's dental cavities, dental decay, holes in the teeth. That's dental caries. So there's all the treatments that either prevent or treat, dental, cavities. Then there's periodontal disease, which is also called gum disease. And there's different types of, gum disease, but basically there's, again, the procedures, the treatments for, gum disease to make it better. So like I said, it's either dental cavities or gum disease is where all the procedures are meant to either prevent, treat, or deal with, the long-term effects of those diseases. Next slide. So there's categories. Most dental procedures, the majority, at least the ones that are covered by Denti-Cal, are kind of broken down into like the preventive services, and there's a bunch of procedures and treatments that fall under prevention, and then there's the restorative. So if we talk about the preventive first, these are, if you think of them as like, these are procedures that are supposed to prevent, either prevent dental diseases. So it's either prevent, getting cavities or prevent getting gum disease. So the three most common that are covered is fluoride, sealants, and then what's called prophylaxis or cleaning. So next slide. So talk about fluoride. So fluoride treatments, fluoride is basically, it's a natural element that's found, in all bodies of water and in rocks, that makes teeth stronger to resist the acid that causes cavities. So that's how fluoride prevents cavities. It makes the enamel, which is the white part, of your teeth that you can see, makes it stronger. And then your tooth is stronger, the enamel, it resists, like I said, acids that, again, will melt your teeth away to get cavities. So Denti-Cal covers, fluoride treatments for kids. And the most common ones are either fluoride varnish. You can see on the top that this kid is getting some stuff painted on his teeth. You can see the little white thing on the right, which is the of the varnish, or foam, fluoride foam. Some of the older people on the webinar might remember, I know when I was a kid, you would go to the dentist and they would stick this foam tray that had this like foam stuff in it, and then you would bite it for a couple of minutes, and then that's the treatment. So next slide. Oh, okay. Okay, so next slide is sealants. So sealant is another preventive procedure, and sealants are mostly placed on permanent first molars or back teeth. Oh, wait. Go back. Yeah, okay. So sealant. So here, so think of sealant, it's like it's a very thin plastic kind of fingernail polish-like covering. When I'm explaining to kids, that I'm going to place sealants, I say it's like a thin fingernail polish that we're going to put on the back teeth, on the ridges, because it covers up the ridges, like the defects of the teeth, so the germs and cavities, the cavity-causing germs don't get in there. It's basically, like I said, like a barrier, like putting saran wrap on it, so that you don't get cavities. So here you can see on the right, there's a tooth, a back tooth before the sealant. You can see it's got all those natural ridges, and that would be like where food and the germs would go. When you start cavities, you put the sealant on and you prevent it. And on the bottom, again, you can see the ridges. It's painted on. That's why we say fingernail polish, because most people know fingernail polish. And then also because to make the sealant goes on liquid hard, they put an ultraviolet light, which is the same, light that people use in the nail shop to harden the acrylic nail. So again, people really understand that when I talk about it like that. Next slide. So now we go to the prophylaxis or the cleaning. So what is it? Because, there's different types of dental like cleanings, and, this is supposed to be like for preventing gum disease. So the way to tell the difference, is a prophylaxis is what I would call a light. It's cleaning light. It's, usually they'll take like the dental hand piece, and there's like a little rubber cup at the end, and then, they go around the teeth, and you can also do it with a toothbrush. Or even an electric toothbrush. So it's only to remove stuff that's like superficial, So, and there is even some question about whether or not, because if you can clean everything off with a toothbrush, do you really need a prophylaxis? But it's a covered benefit, so it's there. Now this is totally different from, if you go to the next slide. So here we're not. I wanted to put this slide here because we're talking now about gum, gum disease, but this is not a preventative service. This is actually like treatment, what they call scaling and root planing. So scaling and root planing is also, if you hear people talking about the deep cleaning, because it's not prevention. This is actually a treatment, because maybe people haven't been to the dentist in a long time. You start getting these deposits that you can see on the pictures, the yellow stuff, around your teeth, and that's glued on. It's not going to come off, with either your toothbrush, or the little rubber cup. So, and it's causing, again, it's like having rocks, in between your gum and your teeth. So it's going to cause an infection. Usually the gums are red and it's bleeding. And this is, like I said, a chronic disease. So the first step is you got to clean everything out. So that is what's called the deep cleaning. And usually, so it's a treatment for gum disease. Usually in the pre-authorization is usually done by a quarter of the mouth at a time. And there's usually, sometimes people talk, again, because it's deep cleaning, there may be some pain. And so usually you may need to numb up, the gum in the quarter of the mouth in order to do the work. And when you're getting your scaling and root planing, either they're going to use hand instruments, which are the ones that are on the top, or they're going to use this, what you see on the bottom is the Cavitron. It's got a tip. It's like a water pick. It's a tip that vibrates, but also shoots out water. So it's, like I said, it's blasting the stuff off of your teeth. You cannot do scaling or root planing with a toothbrush. It's, it has to be mechanically removed. Okay, next slide. Okay, so another procedure, again, that's covered is extractions. They talk about, like in the FRADS, this is one of the things that's covered federally, is because, again, most of the time when it's an emergency and you're having pain in your tooth, whether it's from gum disease or from a cavity, if you can't fix it, it's got to be pulled. So again, extractions, other names for that is like pulling teeth, removing teeth, taking teeth out. And there's many reasons why teeth need to be pulled out. It's not just because they have a cavity or gum disease. Sometimes it's trauma, somebody gets hit in the mouth and, the tooth can't be saved. Or sometimes it's orthodontics, like if you're getting braces and there's just too many teeth in your mouth, they'll have them taken out. Or something like wisdom teeth, because you don't have enough room for them to come out, so they have to be taken out. So again, there's more than one reason for pulling teeth. Just though, if your clients may be telling you, remember the tooth basically has two parts. There's the crown, and you can see here, this is on the left side and the bottom is a molar tooth, a back tooth, and then this is like a front tooth on the right. So teeth have crowns, which is the part that's above the gum line that you can see, and then there's the roots that are below the gum line that are in the bone. So when you take teeth out, you have to take both pieces out. Sometimes, whether it's because of cavity or gum disease, but cavity or trauma, the crown is gone and only the root is left. So if you can't get the forceps, or we call pliers, you need to be able to grab the crown to pull it out with pliers. If you don't, people may say stuff like, oh, they were digging around. And the reason that people say that is because if the crown was off and you got to go in and take the root out, you can't pull it out with forceps. So we actually like kind of go in with a pick. It's kind of like weeding, you have to go down to the end of the root and flip it out. So that's when people say that, oh, dentist was digging around. That's probably what was happening. Okay, next slide. Okay, so now we got this other category, the last category I was going to talk about, which is restorative services. So again, if you think about prevention services as preventing stuff, the restorative services either is going to replace the tooth structure that's been lost or whole teeth themselves that have been lost because of dental disease, whether it's cavity or gum disease. So restorative stuff is like fillings, crowns, root canals, dentures. Okay, next slide. So fillings, there's basically two types of fillings. There's the amalgam filling, which is not kind of known as the silver filling, and then there's the composite, which is like the tooth colored or the white filling. So I want to talk about silver. So both, both types of fillings have like pros and cons. So let me just talk a little bit about them. So for amalgam fillings, like silver fillings, some of the like positive, good part about it, they tend to last the longest. They last the longest usually compared like to the composite filling. They're really easy to put in. It's basically one step, to put it in. And the hardness of the filling of amalgam is about the same as your natural tooth. The cons are, of course, it doesn't look good. We don't usually put amalgam on the front teeth, but we use it on the back teeth. It doesn't look good because it's silver, and gets gray and it's not white like the tooth. If you have the bigger the filling is, the more likely it is that it may break your tooth like later, and this could be like years later. And sometimes, because amalgam is basically metal, because of the silver, it can be sensitive for a while after you put it in, because again, if you have metal in your tooth and you eat something hot or cold, that usually goes away. So those are like the amalgam cons. Okay, next slide. So for composite fillings, again, or the tooth colored or white fillings, so they come in multiple colors. The pros is it looks good because it looks like your teeth. And then composite filling can actually hold your tooth together, because when the way that they get put in, they're basically glued, together. It glues the two sides of your tooth together. So again, it holds it together. The cons are, they just don't last as long, again, compared to amalgam fillings. So if people are going to get composites, you can expect to have them redone, several times in your life, because they just don't last as long. They're very technique sensitive. When you put them in, everything has to be absolutely positively dry, because if it's not, that's going to cause, the glue part isn't going to work as well, and then they're going to start to leak around the edges. So again, very technique sensitive. And because of the technique for putting it in, the gluing, those teeth may be a little bit more at risk for nerve damage, long term, especially if you have the composite done several times, because again of the way, when you do the glue stuff, it's the tooth doesn't like that. So it's a trade-off, right? Of course, we always put composites in the front, but as long as people know, that that may not be the final thing that ever gets done, either for a composite or an amalgam filling in the tooth. It may need work again later, years later. Okay, next slide. So now we come to crowns. So crowns are also called caps. So basically, crowns are done when too much tooth structure has been lost, usually because of cavity, but it could also be because of like trauma, so that a filling isn't going to work. It just isn't going to stay in, or it's just not going to last long. So you do the cap. If you think of it like fillings go inside of the teeth and the cap goes around the tooth, so covers the whole thing. So here you can see, like, there's a tooth that's got a big piece of it that's off, and then dentist comes in and kind of shaves the rest of it down, and then the cap slips on over it. Next slide. So there's two types of crowns that are covered under DentaCal. The first one is the prefabricated crown. So you can see these are pre-made crowns. So basically there's like a box that's got like different sizes of it, and dentist tries to pick the one that's going to have like the best fit. So you can see that with a prefabricated crown, you're not going to get like a perfect fit, where the tooth and the crown meet. If you're doing prefabricated in the front teeth, you know, the color, it basically only comes in like one color, so it may not match like exactly. And in the back, basically they're stainless steel crowns, as you can see. So, you know, there's not a lot of choice, like in terms of the, well, like I said, colors. Next slide. So then you have like the laboratory process crown, which is, you know, kind of like the goal, you know, like the ultimate. And that is covered by Denti-Cal, but again, there's certain conditions. You know, it's not going to be every tooth for every, you know, for every tooth. It's not every tooth. It has to be, like I said, there's certain conditions. It should be covered for front teeth, though. And so then that's where like the handbook and understanding, you know, again, the eligibility criteria, because again, depends on the tooth, you know, depends on the age, depends on the other stuff. But laboratory crowns are custom made. So of course the fit is going to be perfect, you know, at the edges where it meets. If it's for a front tooth, you know, because again, they should be able to get a much better color match because it's custom made. There may be one downside, which is that the crowns that are covered by Denti-Cal, they don't use gold. Actually, they use other metals, nickel, and some people are allergic to that metal. And really, it's expensive lab crowns compared to the pre-made. And so again, the pre-authorization process is really important. And you know, sometimes it has to be pre-authorized several times before it's finally approved, because again, they're really expensive. Okay, next slide. Okay, two more procedures, restorative. Okay, so the next one is like root canals. So root canals, so here, like you see this picture, the thing to remember, so front teeth has one root, and then back teeth either have 2 or 3 roots. So if you're thinking about root canal on the back tooth, it's like 3 times the work, right, of what you see here. So basically in the root canal, what happens there is you it's removing the infected nerve from the inside of the tooth, cleaning it, disinfecting it, and sealing it up. So for example, if you look at the picture on the right, if you look at the first one, that's again most on the left. So a tooth has 3 layers. There's the white part, the enamel, which again you can see. There's a yellow part underneath it. Sorry. Oh, can we go back one slide, please? Thanks. And then on the inside there, what you'd see is kind of red and pink and blue. That's like the nerve. So if you have a cavity that goes through all the layers and gets into the nerve, now the nerve is infected, and that's why you feel pain. So when you do a root canal, you go to the second one, you basically open up the tooth, let all that, clean all that stuff out, all the infected nerve, tissue, everything, and then you sterilize the inside, and then you fill it back up with the pink stuff. So that's how you're able to like keep the tooth, it's dead from the inside because there's no more nerve, but it's still in your mouth because it's still attached to your jaw. So that's how you're able to save teeth. So root canals allow you to save teeth, otherwise would have to be pulled. Another thing to remember though, is that when you get a root canal, again, because like I said, it's dead from the inside, that causes the rest of the tooth to get brittle, you know, like a china plate. So most of the time you cannot get the root canal done without having a crown also on top of it. So both treatment authorization usually has to come together, the root canal and the crown. Okay, next slide. Okay, so the last restorative procedure, of course, that's covered by Denti-Cal is dentures, which can also be called like plates or false teeth. So this is again for teeth that have been totally lost and have been extracted. These are removable, so you can put them in and out at night, and it could have, you know, 1 tooth, or it could have 6 teeth, and be partial dentures. Again, it could be 1, 6, 10 teeth, and then as long as you have like a combination of your own teeth and the denture, or they could be full dentures. So you can see here on the top is kind of a common partial denture where the client has lost all their back teeth, but they still have their own front teeth. So you make a denture that clips on. And then in the bottom, you see this is a nice set of full dentures for somebody that has lost all of their teeth. Okay, so next slide. So that's basically it. If you have any questions, you can contact me here at my NOAA address or my SFDPH address. So that's it.
Thank you, Dr. Hilton, and thank you, Liz. Thank you for the overview. It looks like we have about 5 minutes left here. And actually, it seemed like both of you answered a lot of the questions that were coming in throughout the course of your presentation. So I actually want to ask a broader question to both of you. If you could maybe touch on what are some of the common barriers that you see as patients navigate these systems that you've talked about? And then what local resources can you point people to if they need some local help and resources to navigate these systems?
Well, I'll just throw out, well, two things I think that are barriers is that in the adult, because the adult is optional, and again, how do you, when you had a benefit and then 5 years you don't have a benefit and then you get like a partial benefit back and then it's like, who could possibly, it's so complex. That's what I'm saying. That's the main barrier, is the whole thing is so complex to navigate, as opposed to like Medi-Cal, right? The medical side, you got a benefit, that's it. It's always there. So that's one barrier. And then the other one is just that, like I said, this whole process of, as we like to say, you lose a leg, does anybody question you're going to get a replacement? But you lose a tooth, they make you do pre-authorizations. And so it's just, the whole thing is just set up not so incorrectly, even compared to medicine that, that's why it's really, so you can't really, I have no answers for that in terms of how to make it easier. That's why I'm saying I think that organizations that are able to help clients navigate the system. I'm in the county health department, and a lot of the primary care providers in our own department don't know how to navigate and get dental because there's so many things to know. Can you imagine? And what's a patient going to do? So really, dental, we really do need advocates and health workers to help people navigate. It's really the best solution.
And hi, this is Liz. For me, it's the same thing that, asking the questions when the client says, they say Medi-Cal doesn't cover this. Again, asking them, did they even submit it for a treatment authorization request? Did they try to get it covered? Connecting with Denti-Cal. We also work on dental issues, and we are in the process of hiring an oral health coordinator who would be the point person to troubleshoot these kind of access issues. We also we also encourage folks to reach out to Neighborhood Legal Services. They have a Health Consumer Center toll-free line where that they can also help intervene. And just like I said, reaching out to DHCS to ask, and they will intervene, and they have called the dental office with us on the phone to the provider to discuss how to bill this service that they said the client was not eligible for.
Yeah, I think in organizations, that are patient advocates. I'm just saying, I think in organizations that are patient advocates, I think the idea of having one person who's part of their work portfolio is knowing, the handbook and being able to, again, the more you hear these same kind of questions, because again, sometimes, again, is it going to the provider? Is it going to Denti-Cal? Is it going to Delta Dental, their fiscal, person, in terms of being able to help the patient navigate? Because there's a learning curve to understanding all the stuff. So really needs somebody that's dedicated, I think, one person that really understands it.
I agree.
Thank you so much for providing all this information. We received a lot of questions about whether these slides will be shared, and I think people recognize how much information is in these slides and hope to kind of add it to their resources. And I know that your contact information is provided as well. So we are going to encourage folks to join our network of folks and build these relationships and help each other be the best advocates that we can be for getting the people the care that they need. And so I'm looking at the time, and I think with that, I will again say thank you for joining us today. We will, of course, share all this information, the slides and contact information. So please do be back in touch with any questions, and we hope to follow up with everyone as appropriate. And so with that, we're going to continue to have these conversations with our webinar series. So we hope to get your input. Let us know what else you'd like to hear and what other information can help you do the best that you can with navigating these systems with your clients and community members. So thank you again, Dr. Hilton and Liz Ramirez, for joining us today. Thank you for your expertise and sharing with us. And I also know that there were a lot of really great attendees who are offering their resources as well. So we'll do our best to share out all of that information at the end of this webinar. So thank you all, and we hope to talk again soon. Bye.
Thank you. Bye-bye.